So, in my series on global understanding of facial aging, I highlight this graphic to talk about the importance of volume loss. And I think it's way understated in terms of understanding it. I'm 56. If you look at me, I'm hollow and bony. There's no pulling in the world that can correct this. I can lift up as much as I want, lift up all of this, but there is an eye bag and there's hollowness around my eyes, and that's the unmistakable part of aging, and glasses really do a lot to mask that. So a dirt cheap blepharoplasty is put on some glasses. But I will tell you that when we think about volume loss, we think about these overfilled, ridiculous looking faces, and this is not what I'm talking about. As you look at this person's before and afters, of course I've done other things with skin therapies and a facelift to make her look better, and that's why this is a multi-part discussion. But if you really understand that I don't make faces big. Now, why do people walk around looking massive and insane? Because they're putting it in the cheeks and the lips, and those are two areas I don't do that. I think it just doesn't look right, especially when everything else hasn't been rejuvenated. And the best course of action in terms of replenishing the volume around the eyes is really fat grafting. And it's a long discussion to tell you why fat grafting survives well. I've shot a lot of videos, including over this period of the series, to talk about the longevity of fat grafting. But I want you to understand that the problem I've seen with fillers around the eyes, even in my own hands, is migration of the filler, even 7 years later, even 10 years later, because fillers don't go away. So filler migration around the eyes is a real problem, even in experienced hands. If you stay away from that area, as we talked about this year, fillers are really good in areas of dynamic creases where you simply can't get a comparable result with almost anything else, including facelifting and fat grafting and lasers and skin peels. And that area is incredibly powerful. But when we're talking about fat grafting, aging around the eyes, fat grafting is the best method to get there. It is the safest in my hands. You'll hear other people tell you it doesn't last. You're not going to get smooth results. And I've been doing fat over 20 years. I literally wrote the most popular textbook in the world in 2006 on this subject, called Complementary Fat Grafting by Lippincott, Williams, and Wilkins. And I can tell you fat grafting survives. It does well, and it really helps target that area. And so oftentimes I'm using a blepharoplasty in combination with it for optimal results, but it really addresses the benefit of what's going on. So sometimes there's a little bit of saggy skin, it needs a removal, and sometimes there's a little eye bag that needs removal, and the combination of removal and addition can be very powerful. Brow lifting, I do perform as well. I don't perform as often because I think brow lifts are much more performed when they don't need to be performed, because brows are not as high as people think they should be. If you look at this lady, you can see her eyes look so much more rejuvenated. It almost looks like she needs a brow lift on the left image, but she really didn't have one, because really volume is the key. And all you've got to do to understand the power of volume and about 85% of people not needing a brow lift is to go back and look at your photos when you were younger, maybe at 20, maybe at 30. I'm not talking about the 20-year-old face is very full, and we're not trying to accomplish that. But when you look at the brow when you were younger, I can almost guarantee, in fact, I can guarantee it, it was fatter, fuller, and not that high.